We tend to see surgeons as these incredible figures of strength and precision, right? But have you ever stopped to think about the toll their job takes on them? We're going to pull back the curtain and look at whether being a surgeon is actually hazardous to your health.
So let's start with a number that's, well, it's pretty shocking. Up to 90%. That's the percentage of urologists who report feeling work-related musculoskeletal pain. This isn't just a small issue affecting a few people. For many, it's almost an expected part of the job.
So why is this happening? Well, it really seems to boil down to the culture. In surgery, there's this long-standing tradition that rewards toughness, speed, and basically sacrificing yourself for the job. In that kind of environment, taking a moment for self-care can almost feel like you're not pulling your weight. It creates this massive conflict between what the job demands and what a surgeon needs to stay healthy.
And that leads us right into our first big topic, the straight-up physical toll of being a surgeon. It's a demanding job in ways most of us probably never even consider.
What's really interesting is how these risks are categorized. Okay, so on one side, you've got things you can't really change, your age, your body mechanics, that kind of stuff. But look at the other side, the biggest risk factors, things like standing in one awkward position for hours or using equipment that's not set up right. Those are things that can absolutely be changed. And that's where there's a real opportunity to make things better.
And this picture just says it all, doesn't it? On the left, that's what happens when you ignore ergonomics. You see that surgeon's neck bent way down, creating all this strain. But on the right, just a few simple adjustments, and you've got this neutral, much more sustainable posture. We're talking relaxed shoulders, a straight back, small changes, but a huge impact over a long career.
And you know, the best part is that the solutions aren't crazy complicated. Just look at this table. We're talking about things like adjusting the operating table height, using anti-fatigue mats on the floor, or choosing lighter tools like those magnification glasses surgeons wear. These are straightforward fixes that can make a world of difference. But it's not all about bad backs and sore necks. The physical risks go way beyond just posture. Let's move on to the invisible dangers that are just kind of lurking in the operating room.
So besides the physical strain, surgeons are dealing with a whole host of environmental hazards. You've got ionizing radiation from things like fluoroscopy, which can raise the risk for cancer down the road. Then there's surgical smoke, which is filled with toxic gases. Even just the noise level in an OR can be high enough to break concentration and lead to mistakes. It just shows you how complex and potentially dangerous that workspace really is.
And you know, the toll isn't just physical. Honestly, the heaviest burden a surgeon carries might be the psychological and emotional weight of the job.
This quote from the surgeon, René Lariche, wow. It just captures that feeling so perfectly. When you hold someone's life in your hands and things don't go as planned, that emotional scar is deep and it's something you carry with you.
There's actually a name for this experience. It's called second victim syndrome. The idea is that after a bad outcome, the patient is the first victim, but the caregiver who is involved becomes the second victim. They suffer from this incredible guilt and shame that can lead to some really serious mental health struggles. And all of this pressure, it leads directly to burnout. I mean, look at these numbers. For the general workforce, the burnout rate is about 28%. For urologists, it's around 50%. That's nearly double. And this isn't just about feeling tired, it's a deep emotional exhaustion that makes you feel disconnected from your work. So how can surgeons even begin to manage this? Well, this is a fantastic tool called the Stress Continuum Model. It was actually developed by the US military. Think of it like a weather forecast for your mental state. It helps you figure out which zone you're in, from ready in green all the way to ill in red, and it gives you strategies to cope before that stress turns into a full-blown crisis. Okay, so recognizing the problems is step one. But now, let's talk about what can actually be done. What are the solutions for building a career in surgery that's not just long, but also healthy and sustainable? One of the most effective things is also one of the simplest, the micro break. It's exactly what it sounds like. During a non-critical part of a procedure, you just pause, do a few quick stretches for your neck and back, and then refocus. And studies have shown these little breaks can dramatically reduce pain and improve focus, all without really adding any time to the surgery. And of course, a huge part of resilience is built on strong personal habits outside the OR. You've got these 5 pillars: fitness, getting enough sleep, having a strong support system, making time for hobbies, and, maybe most importantly for physicians, not skipping their own doctor's appointments. But let's be really clear about something. This isn't just on the individual surgeons to fix themselves. Self-care is absolutely crucial, but it's not a cure for a broken system.
the hospitals and institutions have to do their part too. They need to create a culture that actually values the well-being of their staff.
Which really brings us to this final big question. If we want to protect the people who've dedicated their lives to healing us, isn't it finally time that we operate on the culture of surgery itself?